Since using the SafeCrush pill crusher, I have noticed that we're able to, especially some of the more difficult pills, we're able to actually crush them to a better level to helps decrease the clogging of tubes.
There is a medication, methamphetamine. It's a large pill. It is very difficult to crush by hand. If I can recall, I remember crushing by hand, and you would end up with this skin, sort of the medication, the tablet itself, left, and you can't crush it by hand, so you're kind of picking it out to throw it in the garbage because, what if it was going through a J-tube? You can't have that skin, that won't dissolve in the J-tube. So now with the SafeCrush, you put it in, you could actually hear the power of that machine just going through that tablet. And I have yet to find a skin left behind. It's not like hand crushing. And it's so fine and it dissolves easily in water. It has made a huge difference.
We actually were sending a couple of patients out every 3 to 4 weeks to have tubes surgically changed or changed in interventional radiology.
In the past, I've had issues with clogged feeding tubes due to not crushing the pills enough. Since the SafeCrush has come in, I have not had any issues with clogged feeding tubes.
We've experienced issues with clogged J-tubes, and those need to be placed in interventional radiology, and we've actually had a couple of patients who have had to be sent out to have that procedure done every 3 to 4 weeks. And I feel like the finer you can crush their meds, the better it is for them, and that decreases that risk for those patients.
We have not only gastrostomy tubes, we have GJ tubes, which are very infrequent in acute care facilities. But being a long-term care facility with the different body habitus of our patients, a lot of our patients are kyphoscoliosis, so they're twisted, and just general gastric tubes don't suffice for these patients. They need also another tube that travels into their jejunum. And J tubes are very, very small tubes. There are 12, which is so tiny, very, very tiny. And with traditional pill crushing by hand, J-tubes clog all the time. And J-tubes are usually surgically placed. So those are not tubes that you want your medications to get stuck in. And it's a big challenge manually crushing to make sure that everything is of uniform size and gets down the tube. I know now with the SafeCrush, it crushes pills all uniform size. It's powder mixed with warm water. Since we've had SafeCrush, we have not had a J-tube clog on our floor. So it not only helps the nurses, it's saving patients from going to same-day surgery to have their J-tube replaced as a result of clogging.
Well, when it comes to crushing the meds, the SafeCrush makes it like a dust form. When we manually crush it, we still kind of get some chunks, which clog up the tube feeds, because most of our medicines do go in through tube feeds. So the SafeCrush does, yes, very much make a big difference in the form that we get in the end.
If you can't administer all of the medications, you really truly have no idea what the patient has gotten, if it's leaking out or the tube is clogged. And it's uncomfortable for the patient to have to go back and forth to have a tube changed. But overall, it delays care that can be provided to them. It delays them getting their medications on time, which can affect their comfort level.
Very time consuming that we have to unclog them. Sometimes we can do it ourselves, sometimes we can't. Depends on the type of G-tube, J-tube that they have. If it clogs the J-tube and it's too far in, then we have to take it further and call the doctor and get them to unclog it for us.
The difference between manual crushers and the SafeCrush pill crusher, I find that no matter how long I would bang, the pills just wouldn't. I mean, so depending on the consistency, what they're made of, sometimes I would be able to get them completely powder form, but with the SafeCrush, it literally like pulverizes them, and it's just so much better for administration and for preventing clogged tubes.